Good morning, and thank you to everyone who's joining us today. Let me first begin by thanking those who will be speaking, who took the time to join us. I'd like to acknowledge Kings County Sheriff Dave Robinson, who is also the president of California State Sheriff's Association, Los Alamitos Chief of Police Eric Nunez, who is also the president of the California Police Chiefs Association, Sacramento Police Chief Daniel Hahn, and San Francisco Police Chief Bill Scott. Also on with us is Chief Ed Medrano of the California Department of Justice's Division of Law Enforcement. He'll be available for Q&A if there's some particular questions for the Department of Justice as well. So I want to thank them for being with us. They will speak after I finish my remarks, and then we'll go to Q&A. We're here today to talk about saving lives from indiscriminate plagues that are affecting our communities, not just here in California, but across the country. These plagues are common and they are frequent, and everyone, regardless of age, is affected. And this year, because of the COVID-19 pandemic, the effects of these plagues are exacerbated. Plagues I'm talking about are the misuse of drugs, substance abuse. Substance abuse is a public health issue that plagues all of our country. In the last 2 years, California has seen a 25% increase in drug overdose deaths. Tomorrow is National Prescription Drug Take Back Day. Tomorrow, all Californians will have an opportunity to safely dispose of prescription drug medications that are expired or that they no longer are using. It's an opportunity to take these old prescription drugs out of our cabinets and ensure that no one is harmed by the misuse of these medications. And let me be blunt. The abuse of prescription drugs kills. Deaths from drug overdoses exceed that of car accidents, guns, or AIDS. And their acceleration in these recent years has pushed down overall life expectancy in the United States. If you can imagine, that's how bad this is, that the average life expectancy of a person in this country actually shows a drop because of drug overdose deaths. But what's more, due to the COVID-19 pandemic, the problem is getting worse. In fact, according to the Overdose Detection Mapping Application Program, drug overdoses nationally continue to spike each month during this pandemic. In March, it was up roughly 18% over the previous year. April, 29% over the previous April. May, 42%. In San Diego County alone, overdose death rates increased more than 50% in July and August compared to prior to the pandemic in February and March. And in some of our counties, there are more overdose deaths than deaths from COVID. For law enforcement, for healthcare providers, for our public health partners, for all of us who care about our local communities, this is a major challenge. Combating this epidemic needs to be a team effort, and that is why we are here today. Old and unused or leftover medications can be deadly if they fall into the wrong hands or if they are disposed of improperly. We know that if you flush your medications down the toilet, you can poison the waterways that we end up using when we turn on the faucet to drink water. And we know that holding on to old prescription drugs or improperly disposing of pills can open the door to abuse. This is why I want to thank all the leaders who are participating in this press conference and overall throughout the state of California over this next weekend to make sure that we can take back those prescription medications that are no longer needed. At our last Take Back event back in 2019, the state of California set up more than 330 collection sites. We collected more than 56,000 pounds of drugs. And throughout the nation, close to 900,000 pounds of drugs were collected. Tomorrow, October 24th, from 10 a.m. to 2 p.m., California will have sites around the state to collect unwanted, unused, or expired prescription drugs. This service is free, it's anonymous for all Californians. These collection sites will adhere to local COVID-19 guidelines and the different regulations we have in our counties in order to maintain the safety of all participants. I hope you'll visit this website, www.takebackday.dea.gov. One more time, www.takebackday.dea.gov to find a collection site near you. We hope and we urge you to participate. And with that, let me now turn it over to Sheriff Robinson.
Thank you, Mr. Attorney General Becerra. We really appreciate you having this today. From a small county in Central Valley, we started this program 9 or 10 years ago, and it was about my first or second year in office. And we weren't really sure about it at the beginning because we didn't know that there was such a need for something like this. And so we started our program and created our first drop box, and we were just in awe about how many people used the box within a short amount of time. And so because it was so popular, we partnered with our local post office to get secure old postal boxes, so that way there was a secure way where people could drop off without somebody else coming along behind them and retrieving anything out of it. And so we partnered with the post offices, and we were able to secure postal boxes that we repainted and then repurposed those and put them at the local police departments. And it's just been an amazing program. And so each year we look forward to this day because it gives our community an opportunity to really have a safe location where they can drop off these old prescription drugs that we don't want to get into the hands of those people that you spoke of. And so it's been super popular during this COVID crisis. Obviously, we've seen a huge impact on the elderly population during this crisis. And for those families that have unfortunately had a tragedy occur, they now have an opportunity where they can bring those prescription drugs to make sure that they dispose of them in a safe manner. And I reached out to my staff earlier this week to kind of see how things were going this year. And they told me that these last 2 years, they've never seen so much prescription drugs dropped off in these safe locations. And our local Rite Aid has partnered with us as well. And so, we're really fortunate to have this program. We really appreciate you bringing this to the forefront again this year and making sure that everyone knows about it and is aware about it. And we really look forward to tomorrow and making it, an annual thing. And even though we do it on a daily basis, it's nice when there's 1 day a year or 2 days a year that get highlighted that we can make sure our community is aware of these things. So once again, just really appreciate your time today. And now I'll turn it over to the Los Alamitos Police Chief and President of the California Police Chiefs Association, Chief Eric Nunez. Eric?
Thank you, Sheriff Robinson. Obviously, as the president of California Police Chiefs Association, I represent all 332 police chiefs in the state. And what is probably not so obvious is that these individual agencies are dealing with to some degree or other with substance abuse in their communities. More specifically, and the Attorney General mentioned, this is the opioid crisis that is not only facing our state, but our nation. And a great deal of the addiction, abuse, and overdoses, they're coming from prescription painkillers. Since coming here to Los Alamitos Police Department in Orange County, we have been working with DOJ and DEA, specifically with our prescription drug take-back program. And in the last 4 years, I can tell you we've collected several hundred pounds of prescription drugs in our community alone, and it's a very small community. And I will tell you this, in terms of Orange County, the OC Health Agency last report was back in 2017 on this topic, and they stated that the drug overdose deaths increased by 88% between 2000 and 2015 in Orange County. Nearly half of them were from accidental prescription drug overdoses. In fact, in 2011 to 2015, they had 1,200 individuals in Orange County die from opioid-related overdose deaths. Part of the Attorney General's comments about life expectancy dropping is reflected in the largest number, which came from those between the ages of 45 and 54, if you can believe that. But this is a real scary number, I'm about to tell you. 384 occurred between the ages of 10 and 34. These are accidental deaths, most of those, especially at the younger ages, right? During the time period, the same time period, the 490 of the 666 deaths associated with prescription drugs were accidental, which means that's about 74%. there is no doubt in my mind that this program saves lives and does so in a safe manner. So I just want to thank Attorney General Becerra for inviting us to discuss this very important topic and program. And with that, I will turn it over to Chief Hahn of Sacramento Police Department.
Thank you, Chief Nunez, Attorney General Becerra. As the Attorney General mentioned, these drugs in our communities destroy lives, destroy families, destroy our communities. And according to the DEA, and we completely agree, the majority of abused prescription drugs are obtained from family and friends. That means, some medication that you have left over from maybe a surgery in your medicine cabinet. You have a party at your house or friends, they use the restroom, they go through your medicine cabinet and they take some of your leftover pills that you don't even notice because your surgery was a year earlier and you don't even remember how many pills you had in there. For example, both my daughters recently had their wisdom teeth pulled, and they were prescribed very hardcore prescription medication for pain. Now, fortunately, neither one of them took those. They just took over-the-counter like Tylenol for a day or two, so their pain never became to the point where they needed to take that. But we have taken those medications to a drop box because we don't want to leave 40 pills in our medicine cabinet. And so if you think about what's in your medicine cabinet, that can destroy somebody's life. And so we really encourage people to go through their medicine cabinets and put those in your local drop boxes. If you recently had some sort of medical procedure where you were prescribed that, as soon as you know you don't need it, get it out of your house. And so we are a full participant in this. And so this Saturday, like the Attorney General mentioned, between 10 and 2, if you're in Sacramento, you can come to our headquarters and there will be a drop box there. And it might be confusing for some during COVID because, for example, our lobbies are closed during COVID. But you can still come to our lobby and drop off prescription medication at any time because we always have those lobbies manned and somebody will come and open the door and you can drop that off in the drop box. But for sure, this Saturday, come between 10 and 2. There's no questions asked. You just drop your prescription medication in the bin and we can get these out of our medicine cabinets and out of our homes so somebody that's struggling with this or getting involved in this doesn't have free access to those prescription medications. So thanks for inviting us, Mr. Attorney General, and we're happy to participate in this because this will save lives and it will keep families intact and not destroy somebody's lives by getting addicted to prescription medication. And with that, I'd like to turn it over to Chief William Scott with the San Francisco Police Department.
Thank you, Chief Hahn, and thank you, Attorney General Becerra, for taking a leadership role to save lives in our state. Like so many other American cities, large and small, San Francisco has been affected by the opioid epidemic that continues to destroy the lives of thousands of people. For instance, last year in our city, there were more than 440 overdose deaths in 2019, far exceeding our homicide count, which was only 41. As we know in law enforcement, our focus is always to save lives and disrupt the flow of narcotics that enter in our communities, oftentimes illegally, and that is a means to save lives. Now, although enforcement plays a key role and we make hundreds upon hundreds of arrests, we must do more. We have to find other ways to stop the flow of drugs that make their ways into our communities and really impact the most vulnerable people in our cities across the nation. All of us probably have prescription drugs in our cabinets. As Chief Hahn just pointed out, I know if I look in my medicine cabinet, I have medications and things, and I frequently check the expiration dates and dispose of them properly. And really, that's what we're asking everyone to do. We know medicine makes our lives better. When it's used properly, it makes our lives more comfortable. But oftentimes, it's that misuse of that medicine, and that particularly when it gets in the wrong hands, that endangers lives. And that's why National Prescription Drug Take-Back Day is so important. And that's why the work of Attorney General Becerra, the leadership role that he's playing to make our state safer is so important. Now, at the San Francisco Police Department, we have receptacles at all 10 of our police stations. Our police stations are open during COVID, and those receptacles are available to the public 24 hours a day. We take all prescription drugs, no questions asked. You can turn them in anytime. You don't have to say anything, just drop them in the receptacle. It's very easy. So please help, do your part to make our streets and our cities safer. It's something simple that we all can do, and it's for the well-being of our respective cities and our state. So thank you, Attorney General Becerra, and with that, I'll turn it back over to you.
Chief Scott, thank you. To each of our participants, thank you.